Hello, everyone. Thank you for joining us as we talk about the FIP Hospital Pharmacy Section strategy update. My name is Dr. Jonathan Penm, a senior lecturer over at the School of Pharmacy, University of Sydney. Today, I've been joined by Rob Moss, who is our president of the FIP Hospital Pharmacy Section. He'll be presenting information around FIP and the changes that it's gone through over the next for about 10 minutes, and then I'll present the results of a survey that we've done looking at the FIP Hospital Pharmacy Section priorities in regards to the strategy. Now, Rob, I'll just get you to share your slides, and I'll introduce you for that. Oh, there we are, perfect. So thank you, Rob. As Rob has there, he's got a vast amount of experience and is quite involved within FIP. Now we feel this presentation will take about half an hour. And so Rob here has led a lot of clinical pharmacy services in a wide variety of settings and the head of pharmacy. Nationally, he's also been the Director of Critical Event Preparedness for the Dutch National COVID Medication Coordination Centre. He's a member of the National Expert Team Medication Data Exchange. And within FIP, not only is he president of the Hospital Pharmacy Section, but he's a member of the Board of Pharmaceutical Practice Executive Committee, part of the One FIP GPO Data Intelligence Commission, the FIP Technology Forum, and the FIP Substandardized and Falsified Medicines Expert. So thank you, Rob. I'm very excited to have you and to present things that are changing within FIP and to give us background around the Hospital Pharmacy Section.
I'll have to unmute this way. Hello, and thank you very much, Jonathan, for introducing me. And well, we'll hear more about you and your function. Hey, Jonathan is our secretary of the Hospital Pharmacy Section. So the idea about this presentation, I'm running into problems here, is to really actually get you into the setting of a hospital pharmacy section and why are we updating our strategy. And of course it is part because you regularly do update your strategy, but it's also to really show you where do we fit in as a hospital pharmacy section and what's going on within FIP that makes it more urgent to have an update of our strategy session. Clear, as you probably all know, the International Pharmaceutical Federation, the FIP, is the global body representing the pharmacy and pharmaceutical sciences and pharmaceutical education. And very, very importantly, it is linked and has also special relationships with the WHO. And this setting is very important for where we fit in as a hospital pharmacy section too. So one of the things that has changed in recent years is that with Dominique and Catherine, it is now clear that we have a sort of a one FIP vision, and where the basics is that we can have no pharmaceutical care without the workforce, and we have no pharmaceutical care without scientific foundation. So it really is an integrated series of practice, science, and workforce education that is FIP, and that really sets us forward. And having that vision, the FIP set up a strategic plan in 2019 for the coming then coming 5 years. So we will really be looking as a hospital pharmacy section, how do we fit in there? How do we want to fit in? And what do we like to, well, make clear that we, oh, I'm sorry, make clear that we are, I'm sorry about this. Something is going wrong here. How do we fit in the strategic plan, and how does it fit, the strategic plan of FIP fit in with our strategy? One of the points that FIP did is that they said what their goals were put forward in the FIP Development Goals, and it was there to set the goals for the decade ahead. So again, they are the FIP Development Goals, And these two, of course, will be incorporated into the FIP strategy. And Jonathan will go into that later when we're looking at the strategy as we put it up for now. Again, a little picture of where does hospital pharmacy section, where do we fit in? If we look at the three parts of the FIP fits in, the hospital pharmacy section fits into the practice part, and part of the practice side, and it traditionally was in the pharmacy practice and FIP sections, the BPP, the Board of Pharmaceutical Practices, and that had several sections. The biggest one, of course, being community pharmacy, the second largest hospital pharmacy, but many more sections make up the practice part of the hospital pharmacy group. And hospital pharmacy, as mentioned, is part of that BPP. So that is where we fit in the official structures. And what is hospital pharmacy section? Why are we there? The objectives that we have and that that are on the website are quite a wide range. But of course, specifically, it is to exchange views of professional subjects relating to duties and responsibilities of hospital pharmacies. That is a core of us. But it's also about promoting pharmaceutical care and, of course, in hospital-related facilities, being wider than just hospitals. It could also be ambulatory care systems and primary care. Another important point is the one but last bullet point, to pay particular attention to the needs of the developing countries. I like to look at it more specifically at low middle income countries and high income countries, but really it is also there to exchange information and to help further the profession, which can also be the other way around. If we look at examples from, say, Rwanda, where high income countries can learn a lot. But it's about exchange of information. And this is all what the hospital pharmacy section strategy should be about. The vision of hospital pharmacy is quite clear. And they were set already in 2008 with the Basel statements. Those of you who are have been involved in FIP and the hospital pharmacy section, of course, dream about the Basel statements. It's the envisioned future of hospital pharmacy practice. It says all the different parts of it, and this is really what we should be striving for. So we already know where do we want to go. The roadmap is there. It is the Basel statement, and we have different tools to measure your outcomes. It'll be part of the strategy. So the Basel statements are important for hospital pharmacy. But as I mentioned, this is, well, I would not say the old section, but this is how we used to fit in naturally. But FIP is really looking at a different strategy, and they are incorporating more and more views. And one of the important ones is that member organizations are playing a more and more important role. What I mentioned here are just an example of three large hospital pharmacy associations that are member of FIP. And so they too contribute to the whole picture, and more FIP is reaching out to the member organizations. What can we do for them? So it's individual members who are members of the hospital pharmacy section, but it's also member organizations, and many of you are member of these member organizations. So that is it. Another point that is more and more important in the new strategy of FIP are the regional forums. There are so many differences over the globe in practices, and even more so almost in hospital pharmacy practices. So they've reached out to the forums, are reinvigorated the forums, and they play an important part of the FIP strategy and where they're going. And of course, on the background is always the relationship with the World Health Organization, which is an important driver, because that really gives the impact of FIP on a global setting. So this whole landscape, it was not just the sections, not just the BPP, but it is this whole landscape that is changing, and hence it is very important that we change, that we update our strategy, the hospital pharmacy strategy. So what we took as sort of the basis of the new strategy was the strategic plan, the FIP strategic plan, were the FIP development goals, and of course the World Health Organization and what their agenda is. And we should fit in with that and know where we fit in. And just more detail of the strategic plan, it has of course the vision and the mission, but also strategic outcomes, and from that a business plan. And we will be linking into that. And we did a survey already, and Jonathan, in the next couple of slides, he will lead you through the survey and show you how we best link with this strategy outcome, with the strategy of FIP, and how best to set our strategy plan. And it really is a session that we would like your input. We'll give you the opportunity at the end, but not just in this lecture, this webinar, but also later, because it's important. We are there for you as members, and we really love to hear from you what you expect from Hospital Pharmacy Section and the strategy. And this is the chance to contribute. So thank you already, first of all, for just being here at the webinar, but also for contributing. One point I do have to say, FIP expects me to, but I also really and dearly like to mention it. Of course, there is the next upcoming FIP World Congress in Seville in Spain, and I cannot wait to see so many of you in person there, and I really hope you can make it there, because it'll be great to see each other again and having conversations about strategy and everything during the meeting. So without further ado, I will just hand over the mic and then the presentation to Jonathan.
Thank you, Rob. So I'll just get my slides up ready as well. So as Rob alluded to, I'll be going through the survey that the Hospital Pharmacy Section did, sent out to some of its ExCos and member organisations around our priorities for the section, for the Hospital Pharmacy Section in relation to the FIP Vision. For those who aren't familiar with you, I'm the Secretary of the FIP Hospital Pharmacy Section and a Fellow of FIP. Now, to get your mind where FIP is going, the vision of FIP and the vision that the Hospital Pharmacy Section aligns with is that we see a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies, as well as from pharmaceutical care services provided by pharmacists in collaboration with other health professionals. So that's the vision that we're going to. And then we have the Basel statements that show the vision specifically for the hospital pharmacy. What we did is we then looked at the FIP mission and strategies and the FIP development goals, and we asked our executive committee members, our chairs of committees, observers, past executive members, and FIP Hospital Pharmacy member organisation and regional forums where they saw should be the priorities of the Hospital Pharmacy Section. And those are the results I'll share with you. This will probably take around 10 minutes to go through, and then we're going to open it up for discussion and then bring the webinar to a close. So we sent that survey to around 40 individual and member organizations, and we got a response rate of 60%, which we're very happy with, because for those who do survey research, you know, it's hard to get more than 30% a lot of the times. The demographics is we got around half of them was the hospital executive committee members, a quarter were around chairs, committees, past executive, and the other quarter were member organizations. You can see the breakdown by regions that we have around 40% from the West Pacific region, 25% from the Americas, 8% from the African region, 12% for European, 8% from Southeast Asia, and 4% from the Eastern Mediterranean region. So in relation to the Hospital Pharmacy Section and their priorities with the FIP mission, we asked them, how much do you strongly agree with the mission statements put out by FIP, and which one should we align with as a Hospital Pharmacy Section? Of course, we agree with all of their mission statements, but there are some that we have more strong affinity towards. And this was a 5-point scale, with 5 being very strongly agree. And you can see this one up here, they got 4.92, so that's very much a unanimous 5 out of 5. It was advocate for the full utilization of pharmacist expertise for the benefit of people and healthcare system. I think that's what people are really wanting for the Hospital Pharmacy Section, that we utilize and advocate for the full scope of pharmacist expertise. You can see as we go down, we also had a lot of agreement for improved health outcomes by development and implementation of pharmacy services, support pharmaceutical workforce development around the world to deliver our vision, collaborate with international agencies, partners, and other healthcare professions to ensure comprehensive and integrated healthcare for all, and then support and strengthen the integrity of the pharmaceutical supply chain and manufacturing to patients' access. It gives you an idea where people saw the strengths of the hospital pharmacy section and felt that we most align with advocating for the full utilization, improving health outcomes, and supporting our pharmaceutical workforce. We then looked at the other strategies of FIP, and we asked, what was the priority of these strategies for our hospital pharmacy section? Again, this was out of a 5-point scale, with 5 being extremely high priority. And these are being the averages shown here. We got one around 4.5, which again is pretty much unanimous, very close to 5 out of 5 there, that we should support and empower pharmacists to provide high quality, person-centered pharmaceutical care to improve health outcomes for individuals and population alike. So supporting and empowering pharmacists to provide high quality, person-centered pharmaceutical care was a very high priority for all of those who responded for the hospital pharmacy section. And as we go down, it also says to facilitate and enable the sharing of relevant knowledge and professional development tools for all members across countries or regions. And then set standards and advocate for sustainable pharmaceutical care services. Collaborate with global and international agencies and partners to work to eliminate medicine shortages. Focus on members in all that we do. You have some other ones listed down here, but again, I'm just highlighting the ones that were the top priorities of the FIP strategy that those who responded to the survey felt the hospital pharmacy section should align with. We also asked them about all the FIP development goals and what was the priority of those for the hospital pharmacy section. And you can see the one that led the pack, again, 5 being extremely high priority, but the one that led the pack at 4.75 was really patient safety. Patient safety is what resonated with a lot of people around the mission or vision of hospital pharmacy. In fact, everything we do is often around patient safety. And that was telling us as part of the hospital pharmacy executive committee that anytime patient safety is talked about within FIP, we should make sure hospital pharmacy is there at the table, because that's something we know intimately and are very acutely conscious of. And then we have other ones down here like antimicrobial stewardship has obviously been a large focus within the hospitals, and that's come out that should be a large priority for the hospital pharmacy section, followed with competency development, sustainability in pharmacy, pharmacy intelligence, digital health, person-centered care. And that again just gives you an idea of where the priorities are felt within the hospital pharmacy section, where we should be focusing our efforts over the next 5 years. We then asked the members or those who answered the survey, what are the critical success factors that we should make sure we focus on for our strategy. And I broke this down by individual members and organizational members. Within the individual members, they've asked that we should really integrate a common view of hospital pharmacists to really be a global network, to be a platform of knowledge sharing among hospital pharmacists, that we should remain involved, engaged, visible, and relevant. Membership numbers, engagement, and involvement is important. Also integration into the one FIP strategy to have a clear purpose for the hospital pharmacy section, while also being agile and responsive to change and focus on the needs of the members. We should have effective and efficient use of technicians, automation technology, collaboration with the hospital pharmacy member organizations, as well as promoting the Basel Statement Self-Assessment Survey that's been made available online for free for all of our members. Also improve access to a wider range of educational resources, policy and practice development. So it kind of gives you an idea of the things that we should make sure we focus on and should be part of that strategy. And then the organizational members, like I said, some similar things, right? Agile and responsive to change and focus on needs of their members. We also added that we need a high level of engagement by hospital pharmacists from member organizations, impact relationship development, demonstration of the value of hospital pharmacists, gain influence among all the pharmacy professions and among national and international health system policies, and promote information sharing and understanding of systems, problems, and situations surrounding hospital pharmacists in each nations. So we've got some more higher level visions or strategies put here, which we think is really helpful to inform our future strategy for the section. There were some quotes that also we've taken out from the survey that people added at the end. And I think this kind of highlights some of the background thinking about what we do, or why we do what we do. And I think it was just really helpful to share this with you so you could see our thinking behind it as well. As a global agency, FIP's focus should be transnational. All of the HPS activities should recognize the diverse standards and capabilities that exist across the globe and incorporate processes by which the more developed can assist the less developed. Development assistance will work best if it is aligned with the needs of the less developed, not the achievements of the more developed. Development is multifactorial. Working on a single issue like technicians or antimicrobial resistance in isolation of all others will not deliver best results. I think that's really helpful and puts into context some of the goals of the hospital pharmacy section that Rob talked about, of why we make sure to include the developing countries within all our activities and ensure that that is a way that we can really unify global hospital pharmacy practices. It was also just a note, FIP needs to be really clear about what is the role of FIP, what is the role of its subsection, what is the role of its organizational members, and what is the role of its individual members. This is often confused and crossed over in goals and statements, and efforts are wasted and communications can be confused. And I think this really highlights the reason why we pushed forward to do this strategy. There have been lots of changes within FIP that Rob has already mentioned, and it needs to be really clear now, how does the hospital section add to that? And putting this strategy together will make that vision and that strategy very clear to the wider FIP and to our own members, to ensure that we are not wasting or duplicating effort. We also then looked at what activities are happening within the wider WHO, FIP, and the hospital pharmacy section. We kind of know hospital pharmacy, we really care about patient safety, about utilizing the full scope of a hospital pharmacist. What's happening at the global scale, a little bit beyond that within WHO? Now, all of you are intimately aware that COVID-19 has been a large focus within WHO. And so FIP have put together the FIP COVID-19 Information Hub, and the hospital section have been putting webinars around COVID as well to update our members. Another strategy within WHO has been focusing on antimicrobial resistance. And so FIP have put together the Antimicrobial Resistance Commission, which has a repository of antimicrobial resistance resources. And within the hospital section, we've also developed a research on antimicrobial resistance committee to help support and add to those resources. Within WHO, they also have the 3 billion targets going on at the moment. And the three main issues that they want to push forward is universal health coverage, health emergency protection, and healthier populations. And to cover those 3 targets, FIP has put things together such as Transforming Vaccination Program, the FIP Equity RX Program, FIP Non-Communicable Diseases Program, the Primary Healthcare Program. And we've also, as a hospital section, put together webinars to support those programs. As a lot of you are aware, WHO has also had the Medications Without Harms Challenge, and they highlighted 3 key areas to reduce medication harm or increase patient safety or medication safety. Those were focusing on high-risk situations, continuity of care, and polypharmacy. And as a result, the FIP have put together a medication review and use review toolkit together, a medications reconciliation toolkit. They've got a document around patient safety and the pharmacist's role, and the FIP statement of policy, the role of pharmacists in promoting safety, patient safety. So FIP has been very active within that patient safety space. We've also got our Basel statements within the hospital pharmacy section that's heavily based on patient safety. So that's always been one of the foundations of our future vision. And then we've hosted webinars within the hospital section again to support those initiatives. There's been pushed within WHO also to have more data analytics and delivery for impact. And FIP has also tried to get more data analytics with their Global Pharmaceutical Observatory. Within the hospital section, we're trying to help you with analytics, with our members, by putting together our Basel Statement Self-Assessment Survey. With previous webinar on that, you can access that self-assessment survey through our website, and you can assess how your hospital is going compared to other hospitals, and in relation to our Basel statement. So it provides you with data, which Basel statements are you doing well on, which ones could be improved, and then you also have data analytics to say, and how are we tracking compared to other similar hospitals. And we're hoping those data analytics will be very helpful for our members. WHO also has a focus around workforce, and FIP have their FIP UNESCO UniTwin program, Sustainability Arcs program, Workforce Development program, and FIP Wise Women in Science. Again, to push around the workforce, that as the hospital pharmacy section, we've been supporting those programs. And last, there's been the UN Sustainable Development Goals, which has led really to the FIP Development Goals. And as the hospital section, we've also crosswalked our Basel statements with the FIP Development Goals, showing that we have already focusing on all those development goals within the Basel statements, but we do need to have a bit more focus on antimicrobial resistance within our Basel statements. So with all that put together, I know there's a lot to take in, a bit about where our priorities are, where we see our vision and what we're currently doing. The Hospital Pharmacy Section Executive Committee have put together this draft mission statement and a draft strategy. And this is where we would like to get your input. So I'm going to put into the chat where you can put your input. But as you can see here, our mission is that FIP Hospital Pharmacy Section mission is to advocate and support the full utilization of hospital pharmacists and support staff's expertise for the benefit of people in healthcare systems. And that really came through throughout our survey. And through the strategy, the ones that we thought should be focused on is one, support, facilitate, and enable sharing of resources for hospital pharmacy, set standards for hospital pharmacy practice and workforce, seen within our Basel statements, but really underpinned by patient safety. We should focus on individual FIP members and FIP member organizations in all our activities. And we should focus on global needs. So things that affect both developing and developed countries, such as antimicrobial resistance, while also highlighting best practices in hospital pharmacy. So that gives you an idea of where we think we should be moving to. So I've put into the chat a link there for the Padlet. And so I might just stop sharing this and I'll show you the Padlet. Now, this is the second time we've run this webinar and we're still keen to get your feedback. So we've got some feedback already from the first group and I'll share the Padlet so you can have a look at that. This just has, this is the FIP mission that we're thinking of. This is the current vision of the FIP. And then we have our strategies linked throughout. If you want to add a comment underneath, just type it within the add comment. So click on the link in the chat, we'll take you to this site, you can add a comment. And if you want to add a brand new idea that's not here already, just click on this plus button at the bottom and you can bring up a whole new idea, such as these ones, like, if the aim is to support hospital pharmacy practice in developing countries, have hospital pharmacies in these countries been asked what would be most beneficial to their practice? And so we've got a bit of a response there that we have regular executive committees where we have members from all different countries or all different WHO regions, and that's where we always get feedback from our members on what's important to them and where we should be focusing on. So I'll stop sharing there and I'll pass that over to Rob.
Yes, great. Thank you, Jonathan, for this very clear presentation on and all the work that has been done already to get this strategy going. So again, the idea about this webinar is to first of all inform you what we're going on to, but really getting input from you. See, there are 16 participants, and the previous one, it had about 16 participants from all around more the Eastern Hemisphere. Well, it's not the hemisphere, it's the length parts of the country, because it is a morning session. But it's really important that you feed us with your information, because we can only have a strategy and if it is really linked to what you want and what is important to you. And I'm not sure, of course, who is represented here, whether you're representing an MO, but mostly will be individual members. And that, of course, is the hardest to get the information from. So please use this webinar and use this recording, or share the recording, and we will share it in our newspapers. And feel free to go to the Padlet anytime and think of up ideas. Don't be shy, and please give us the feedback, because it's really important for us that we feel that you are part of the hospital pharmacy community. And I must say, being the president of the hospital pharmacy section at this point is really being a very proud person to have seen all the efforts that hospital pharmacists have been going through in the last years with COVID. It's tremendous to see the effort to keep patients safe, to keep patients supplied with medication throughout difficult circumstances, not just COVID, also about wars or migration. But it is important to see how we can support you, and that should come back in our strategy. So again, please feel free to contribute. It probably is quite a lot to digest in once, but
I might just also tell them about the next steps,
yeah,
so that they're
please
aware.
do. Yes, please.
So what we're doing at this stage, we've opened up the Padlet to our members, and we'll keep the Padlet open for probably the next 3 to 4 weeks, so you have time to add in your thoughts even after this webinar. We'll then feedback the results of these webinars in our newsletter, as Rob has suggested. If there are points that need further discussion that come out of that, then we'll host some discussion forums. But we do hope to present to you our mission and strategy at Seville in Spain, and we're really looking forward to seeing you all face to face there. But we are trying to get as much feedback as possible. We are a member-led organization. We're run by members, for members. Your feedback is very valuable to us. We want to make sure that we are meeting your needs. In fact, I might just share a slide showing some of the activities that we are planning for the future with this strategy in mind. Just quickly sharing it, just to give you some idea. These have been thrown together by people on the executive, but we understand the Basel statements are our future vision, and we do think they're still relevant for all countries, but we do plan to do a minor revision on them. Probably have a bit more focus around antimicrobial resistance that we found from the crosswalk, and now that we've seen globally the impact of the pandemic, we might need to add more around emergency preparedness. But then we've also heard from our developing country and the nations we've partnered with that they would like to have steps to implement some of the Basel statements and indicators to measure the Basel statements. And then other places might also like to have more assistance on how to use the self-assessment surveys, particularly with member organizations, how they can use it to help their members and track the progression of pharmacy practice within their country and region. There's also been talk around doing more research around antimicrobial resistance, having more representation of pharmacy technicians and assistants, training of pharmacy technicians and assistants, and also now training for health technology assessments. We know hospital pharmacists have a great skill set for evaluating research, evaluating the evidence of new medicines. And new medicines is a technology, but we can use that same skill set to also evaluate health technology that's coming into a lot of our hospitals and is becoming more mainstream. So that just gives you an idea of some of the activities we feel aligned with the strategy so far. I'll stop sharing that. Okay. So I'll leave that with you, Rob.
Some activity on the Padlet, or again, and this webinar will be available to online I think by tomorrow. That's what FIP told us. And the Padlet, then of course the link to the Padlet will be there, and it'll be open for some time after this.
Yes.
So again, please contribute, and we really hope to see you in Seville. And if that is not possible, to interact in other ways, because we will have to find ways to interact. That will be part of the strategy, that you feel supported. And the newsletter, of course, is one of the main points of communication. So it'll be more in that. Yeah, there's some information about where the webinar is in the chat, where it will be, where you can find the webinar. So having said that, I think, Jonathan, this is a bit what we would like to share with you. Somehow we can't let any of the members, it's a nice group of 16, so we could have had a bit of a verbal interaction, but that technique doesn't allow that. So the interaction would be through the Padlet, which again will be open for some time. And having said that, Jonathan, are there specific things you would like to add, or?
No, it's great to see. I can already see comments in the Padlet, so thank you very much for those who've done that. We're very excited to engage with our members and make sure that we are always listening. We'll put also that link, like we said, with the webinar. We'll put that link with the newsletter. We'll make sure that people can continually put their thoughts around our strategy. But as we've said, this is your section, and so we want to make sure that we're meeting the needs of our members, those who have attended today. So thank you very much.
Yeah, thank you very much for attending. And I think it's everything being open, I don't think it's, well, useful to take up very much more of your time. We had intended it to be approximately 30 minutes. Well, we're 34, so that's great. Thank you all for attending. Thank you for your contributions on the Padlet and in thought. And feel free to mail us when there are things, not just about the strategy, but also about anything that you think Hospital Pharmacy Section can do for you. Really, it's very important to have you. And I'm proud to be part of the hospital pharmacy community. And well, hopefully we see each other soon and otherwise have other interactions. And please take care of your patients, but also take care of yourselves and be proud of what you're doing. And I think we're proud of being hospital pharmacists. So with that, thank you very much for attending, and well, see you soon.
Thank you, everyone.